Snoring is an all too common household problem. Today on Medical Montana, Dr. Pargett discusses the causes of snoring and sleep apnea. Dr. Pargett, snoring and sleep apnea are more than about just losing sleep. It's about quality of life. Tell me a little bit about some of the causes.
It really is. Snoring and sleep apnea are a problem where people have restriction of airflow when they go to sleep. People, I'm sure, are very aware of snorers, grandpa or something like that, but it really means that they're not getting good airflow into their lungs, and that can affect not only the quantity but the quality of their restful sleep. People that snore make noise, but people that have sleep apnea, really, apnea is a word that means no breath, and so they really have pauses in their breathing that can cause the oxygen in their bloodstream to drop low.
Can snoring lead to sleep apnea, or I guess what are the differences between the two?
Well, as I mentioned, it's kind of a continuum. So there are people that simply are snorers and make noise, and that's not only a problem for their sleep, but often is a problem for other people in the household. There are couples that can't spend the night in the same bedroom. There are people that can't spend the night in the same hotel room when they're on business travel. And so snoring can be a noise problem, but also if it means restricting the airflow enough, it can affect their body's ability to get into deep, restful levels of sleep. Sleep apnea is the extreme of that, where people have actual pauses in their breathing. So it really depends on how long they've had the problem and other factors.
And what causes a person to snore? I know you talked about the buildup, but again, is that something that you can change with your environment or with your diet, or what are some of the things you can do?
Snoring and sleep apnea can be conditions that are aggravated by nasal congestion, people that have allergies or sinus problems. It can be aggravated by the structure of their face and their head. They may have a deviated septum where the wall in the nose is not straight, or they may have a tongue that is in a bad position, or large tonsils. All of those things can narrow the airway and make it easier for them to have restriction of airflow and then snoring or sleep apnea.
Okay. You talked a little bit about quality and quantity of restful sleep. Can you elaborate on why that's so important?
Well, our body goes through different levels of sleep at night, and dream sleep is one of our most restful levels of sleep. It's called REM sleep. And when people don't get enough of sleep in those levels, they're quite tired, and sleep apnea affects that.
All right. Thank you, Dr. Pargett.
Mm-hmm.